David is 62. He lives in Liverpool. He has had COPD for 4 years. He's on triple therapy, the full treatment with 3 different medicine combined in a single inhaler. And he came to my clinic still breathless, still struggling to walk to the shops, still waking up at night fighting for air. I watched him use his inhaler. His inhaler technique looked fine. So I asked him one question. David, where is your spacer? He looked at me and said, the hospital gave me one 2 years ago. I used it for a week and stopped. Didn't think it made any difference. Here is what nobody had ever explained to David in that 10-minute hospital appointment. Every single time he used his inhaler without that spacer, less than 20% of the medicine was reaching his lungs. The other 80% was hitting the back of his throat and doing nothing. He wasn't failing his treatment. His treatment was never arriving. And by the end of this video, you will understand exactly why and how one piece of plastic changed the entire trajectory of his disease. I am Dr. Suman Paul, an NHS consultant respiratory physician and a principal investigator in COPD clinical trials with a private practice in Manchester and Liverpool. Quick disclaimer, I am a doctor, but I am not your doctor. This video is education only. If you are struggling to breathe at rest right now, call 999 and drop a comment for me now. Do you own a spacer and do you actually use it every time? Type yes or never had one. I read every single one. Let me show you what happens the moment you press that inhaler. The medicine leaves the canister at roughly 30 meters per second. That's over 60 miles per hour, almost motorway speed. It hits the back of your throat almost instantly before you have ever finished breathing in. That's the problem. Without a spacer, the clinical evidence is clear. Only 10 to 20% of the drug reaches your lungs. The rest lands in your mouth and throat, gets swallowed, and never reaches the airways it was designed to treat. Now add a spacer, something as simple as this, and the number flips. Lung deposition rises to 40%. That's 3 to 4-fold improvement. Same inhaler, same drug, same dose. Completely different result. This isn't a marginal upgrade. For a lot of patients, it is the difference between the medicine working and not working at all. But here is the part most people miss. A spacer isn't just a hollow tube you are breathing through. It is doing 2 very specific jobs, and once you understand them, you will never skip it again. First, it slows the aerosol down. That high velocity spray fires into the chamber, loses its speed and turns into a slow suspended mist. Now you can breathe it in gently. You can no longer have to coordinate pressing and inhaling at the exact same split second, which by the way is a step almost everyone gets wrong. Second, and this is the clever part, it lets the propellant evaporate before the drug reaches your mouth. Inhalers use a propellant to push the medicine out, and it coats the drug in large, heavy droplets. Without a spacer, this droplet crashes into the back of your throat like gravel against a wall. Inside the chamber, the propellant evaporates, the particles shrink, and what's left is a fine mist, small enough to sail deep into your airways. So the spacer doesn't just deliver more medicine, it delivers better medicine in a form your lungs can actually absorb. If this is already clearer than any appointment you have had, that's exactly why I make these videos. Subscribe to this channel for credible respiratory content every week. And I run a free lung health community with a weekly newsletter. No cost, just clear evidence-based guidance. The link is in the description. Now let me tell you about Margaret, because her story is David's story flipped, and the difference between them comes down to one single habit. Margaret is the same age as David. Same diagnosis, same inhaler, same triple therapy. The only difference, Margaret uses a spacer every single time. She was taught properly on a separate appointment by a respiratory nurse who actually had the time to show her. 18 months in, Her CAT score, that's a COPD assessment test, the standard measure of how much your lungs affect your daily life, dropped by 6 points. 6 point isn't just a number on a chart. It's walking to the shops without stopping. It's a full night's sleep. It's getting your life back. Margaret and David, same disease, same drugs. One uses a spacer, one didn't. That single habit changed the trajectory of both their lives. And here is why I need you to hear. David wasn't doing anything wrong. Nobody ever told him it mattered. That's not a patient failure. That's a system that hands people a device and sends them home. So let me make sure that doesn't happen to you. Because owning a spacer changes nothing if you are using it wrong. And there are 6 steps that decide whether it works. Step 1, prepare. Take the cap off your inhaler and shake it 5 to 6 seconds. This mixes the drug evenly through the propellant. Step 2, attach. Insert the inhaler firmly into the back of the spacer until it seats securely and make sure it is straight, not at an angle. Step 3, seal. Sit or stand upright. Place the mouthpiece between your teeth and close your lips fully around it. No gaps. If air escapes, so does your medicine. Step 4, press and breathe. Press the canister once, only once, to release a single dose into the chamber, then breathe in slowly and deeply. Count to 5 as you inhale. Step 5 is hold. When your lungs are full, hold your breath for 10 seconds if you can. If 10 seconds is too long, and for many COPD patients, it is hold for as long as is comfortable. This gives the particle time to settle, then breathe out. Step 6, wait. If you need a second dose, wait 30 to 60 seconds before repeating the whole process. And remember this, it is not a race. Faster does not mean better. Rush a second puff and you will cough half the first one out before it is even deposited. Slow and deliberate every single time. Now here is the step that decides whether your spacer keeps working over time. And it is the one almost everyone gets wrong. Because it's the exact opposite of what your instinct tell you to do. Spacers build up static electricity on the plastic walls. When they do, the drug particles cling to the sides of the chamber instead of floating in the mist you breathe in. And your deposition quietly drops without you ever knowing. So cleaning isn't about hygiene, it's about keeping the medicine airborne and effective. Once a week, take the spacer apart and wash both pieces in warm water with a small amount of mild washing up liquid. Don't use boiling water, it wraps the plastic. Don't use bleach or disinfectant, the residue can irritate your lungs. And now the step most people ruin. Do not rinse it afterwards. That thin film of detergent left on the plastic is exactly what stops static electricity building up. Let it drip, dry on its own on a clean surface. Do not wipe it with a cloth or a paper towel because that friction builds static backup and undoes the entire wash. And check for valve regularly. That little silicone flap, if it's stiff, torn or not sealing, replace the spacer. Most spacers need replacing every 6 to 12 months. Spacers are available via your GP or hospital doctor through NHS prescriptions. This particular spacer is called Easy Chamber. It's also available on Amazon and cost around £10. I have provided a link in the description if you want to buy one. This particular brand can be cleaned in a dishwasher. But here is the thing that keeps me up at night, and it's bigger than percentages and cleaning routines. Because when the medicine hits your throat instead of your lungs, it doesn't just do nothing. It actively sends your care in the wrong direction. 3 things happen. First, local side effect. Steroid landing in your throat causes oral thrush, a hoarse voice, a sore throat you have been blaming on the weather. Second, this is the one that quietly costs people years. Poor delivery looks exactly like treatment failure. You tell your GP you are still breathless. They can't see that the drug never reached your lungs, so they escalate. One inhaler becomes two, two becomes triple therapy. More drugs, more cost, more side effects, when the real problem was never the medicine. It was the delivery. And third, you lose faith. You start thinking these inhalers just don't work for me. So you use them less or stop altogether. A piece of plastic that costs less than a single prescription changes all three of those outcomes. So what happened to David? I saw him 3 weeks after he started using a spacer. Same triple therapy, same doses, same diagnosis, but his walking distance has improved. He was sleeping through the night for the first time in month, and he said something I will never forget. Nobody ever told me why the spacer mattered. That's exactly why I made this video. So here is what to do. If you use a meteor dose inhaler and you don't have a spacer, ask your GP or respiratory nurse this week. If you have got one sitting in a drawer, take this as your sign to pull it out and start using it properly, the way I just showed you. And if you are in Manchester and Liverpool or anywhere in the Northwest and you have been on inhaler for months without feeling better, it might not be the medicine at all. You can book a consultation with me directly at the link in the description box. No GP referral needed and often within days. I will review your full regime, your technique and your device and tell you exactly what's going wrong. Over half of patients on these inhalers don't use a spacer. That's not just a statistics. It's thousands of people on escalating treatment they might not even need. David got his life back with a piece of plastic. So can you. And if this helped, join the free lung health community and newsletter in the description and share this with one person you know who has been quietly struggling. I am Dr. Suman Paul. Take care of your lungs. They are working harder than you think. See you in the next video.